EMT Practice Test 2026 New Emergency Medical Technician Exam 25 questions. Question 1. Normal adult respiratory rate is 8 to 10 bpm, 12 to 20 bpm, 20 to 30 bpm, 30 to 40 bpm. The standard range for an adult is 12 to 20 breaths per minute. Question 2. A patient with stridor likely has lower airway obstruction, upper airway obstruction, asthma, heart failure. Stridor is a high-pitched sound indicating upper airway issues. Question 3. What is the first priority at an emergency scene? Patient care, personal safety, communication with dispatch, crowd control. Scene safety and personal protection are always first. Question 4. Suctioning an adult should not exceed 5 seconds, 15 seconds, 30 seconds, 1 minute. Limit suction to 15 seconds to prevent hypoxia. Question 5. The golden hour refers to the time it takes to reach the hospital, the first hour after a critical injury, the time spent on scene, the shift change. Survival rates increase if definitive care is reached within 1 hour. Question 6. Nitroglycerin is primarily used for high blood sugar, chest pain/angina, seizures, allergic reactions. Nitro dilates coronary arteries to relieve chest pain. Question 7. The correct depth for adult chest compressions is 1 inch, at least 2 inches, 3 inches, 5 inches. Compression should be at least 2 inches deep for adults. Question 8. A patient in hypoglycemia has high blood sugar, low blood pressure, low oxygen. Hypo low, glycemia, sugar. Question 9. What is the compression to ventilation ratio for 2 rescuer infant CPR? 30:2, 15:2, 5:1, 10:2. Ratio changes to 15:2 for 2 rescuer pediatric/infant CPR. Question 10. A standard precaution in EMS includes gloves, eye protection, gown, all of the above. BSI, body substance isolation, protects the provider. Question 11. The prefix hema- refers to heart, lungs, blood, liver. Hema means blood. Question 12. What is the first step when using an AED? Attach pads, press shock, turn it on, clear the patient. Turning on the device initiates the voice prompts. Question 13. Which of the following is a sign of shock? High blood pressure, slow pulse, pale, cool, clammy skin, warm, dry skin. Hypoperfusion, shock, typically presents with cool/clammy skin and tachycardia. Question 14. A patient with a pulse but no breathing should receive CPR, rescue breathing, defibrillation, oxygen only. If there is a pulse, focus on ventilation, 1 breath every 5 to 6 seconds. Question 15. The I in the AVPU scale stands for airway, alert, anxious, apnea. AVPU, alert, verbal, pain, unresponsive. Question 16. In a mass casualty incident, red tag means deceased, delayed, immediate, minor. Red is for life-threatening but treatable injuries. Question 17. What is the primary function of the diaphragm? Digestion, circulation, respiration, movement. The diaphragm is the main muscle of breathing. Question 18. Which heart rhythm is shockable by an AED? Azystole. P. Ventricular fibrillation, VFib. Normal sinus rhythm. AEDs look for VFib or pulseless VTach. Question 19. Where should you check the pulse of an unconscious infant? Radial, carotid, brachial, femoral. The brachial pulse is most accessible and reliable in infants. Question 20. What is the anatomical term for front? Posterior, medial, anterior, distal. Anterior is toward the front.